Welcome everyone to the YOSI session. Thank you. So, this session is will be moderated by me, Dr. Nilesh Kumar, Joint Secretary of YOSI, and Dr. Pratik Nishant, who is one of the most active members from YOSI, and he is almost leading the YOSI Bihar chapter. And so we have Dr. Abhishek with
Myself,
us.
Dr. Abhishek Singh, editor was Varanasi.
And thank you, sir, for being with us. And we will have our chairperson, Dr. Abhishek Anand, with us soon. We will be starting with our panelist, Dr. Samiksha Agrawal is here. Dr. Ankit Agrawal will be joining us soon. So, Dr. Saranya. So, I'll request Dr. Saranya to start with her talk. She will be talking about toolkit of a resident must have from books to instrument, and she is from AIMS Patna.
Hi, good morning all of you. I hope I'm audible. Firstly, welcome to Patna. I hope you're having a good time despite the cruel weather. So my topic for today is an ophthalmologist's toolkit, must have from instruments to books. I don't think I have anything new to say to you today, but this is mostly a recapitulation or a reminder of all the things that we can kind of celebrate day to day that actually make us the ophthalmologists that we are. So to begin with, we know about the direct ophthalmoscope, which has largely lost favor because of COVID. The retinoscopy, as people say, is both a science and an art. And while there are a number of sources from where we can learn the science of it, the art can only be mastered through a lot of practice. And sadly, a lot of us do not get time during residency, at least I can speak for myself, to master this art. Apart from this, there's the 90-D lens, and fundus details are viewed so intricately with this 90-D lens using a slit lamp. Apart from this, we also know that people use 60-60 lenses and 70-80 lenses. But the best tool for viewing the fundus today, after dilation, is probably the indirect ophthalmoscope, coupled with the 20-D lens. It enables us to see views like this. And this is probably what makes ophthalmology so fascinating as a branch, because a number of times, without even touching the patient, we can see structures like nerves and vessels as they are. This is a privilege that not a lot of branches enjoy. Radiologists do claim that they can see all this, but that's in black and white. They don't see it in color, right? Apart from the 20-D lens, people also use 28 and 30-D lenses. We can also mention the scleral depressor. This is the Shepin's scleral depressor, named after Charles Shepins, the father of the indirect ophthalmoscope. When mentioning the scleral depressor, it also brings us to the pediatric speculum, which is often used for ROP calls. We can also keep distilled water with us. This is very important while viewing the fundus during ROP calls. If we do not have a scleral depressor, however, we can make use of a simple Q-tip for scleral depression, because it's important to view the fundus in entirety, especially the periphery when ROP calls come. Apart from this, we know of these drops. The most common drops that we use are Paracaine, Proparacaine actually, but calling it Paracaine has become so common. Apart from this, any broad spectrum antibiotic drop, dilating drops, which have tropicamide and phenylephrine, and lubricant drops. Lubricant drops used for moistening strips containing stains, but they're also very important because a number of times people do come up to us and ask for random drops. I think this is something that all of us have gone through. They expect us to be carrying these drops and they want some of these samples. Apart from this, we know that the gonioscope is also very important for viewing the angle. If you're not comfortable with the 2-mirror gonioscope, you can use a 4-mirror gonioscope. Also, the 2-mirror gonioscope mandates the need of a coupling agent. Apart from this, we know of strips, the rose bengal or the lissamine green strips, but the most important is the fluorescein strip, especially for examining cases of chemical injuries, because it enables us to gauge the extent of the actual injury, which has a very important role to play in the management of the injury. Going on to the next one, we can also keep Amsler charts with us, or Ishihara charts. Amsler-Du charts for documentation of the fundus findings, and most importantly, a set of great color pencils to document all these findings. Before I go on to books, I know everyone here has probably gone through all the important books like Kansky and Yanov, and whatever you're comfortable with, even subspecialty books like Krashma, or anything that you're comfortable with in your fields of specialty. 2 books that I want to mention, which are not really part of the curriculum, are Reflections of a Pupil by Dr. Rishi Gupta and Waking Up Blind by Tom Harvin. These are excellent works of non-fiction which are actually a great insight into your life beyond ophthalmology as an ophthalmologist. So these make for great reads whenever you have time. If you're interested, you can definitely go through these. So that pretty much brings me to the end of my talk. Thank you.
That was an sorry. That was an excellent talk, Dr. Saranya. Dr. Samiksha, do you have any comments on what else a resident should have?
Yeah, so very nice presentation, and the most important thing other than the drops, you should have torch with you at every time in your apron. That is very important. And other than that, I think as soon as you join residency, 90D is the most important thing which you should buy at the initial phase. And once you are good at the indirect ophthalmoscope, then 20D is the secondary thing which you should buy. But the first thing is slit lamp examination in 90D, and DO, I think it is becoming obsolete nowadays. That's what I have seen.
Sir, any comments?
Yeah, it was perfect. If you, Samiksa has rightly commented that you must have put torch in your apron all the time. And other things that I would like to say, few instruments also you should have a small instrument kit also. In that you should, speculum and a small forceps should be there always.
I'd like to add, it is also sometimes advisable to have a set of your own suturing instruments so that you can try suture practice at the end of every operation theater session or things like that. So it's not expensive to buy 4 instruments and keep them in a pencil box well padded with cotton. And at the end of the OT, you can use the leftover sutures from the day and try your hand at suture practice. So that is something which I'd like to add.
And for the textbook, I would like to add, have an iPad. That is the must-have right now. You have an iPad, you have all the soft copies available, now legally available because all the pharma companies are sponsoring the textbooks. Use an iPad so you have all the reference book handy with you and you don't have to carry a lot of weight around with you. And that way, the iPad also has so many features of underlining, highlighting. So at the end of the 3-year course, you will have all the highlighted course, so you can go through and revise your curriculum and be ready for the exam also. So it's just not for referencing, for preparing for your exam also, you can have that iPad. So.
And definitely, and one more thing that is very important to have, you have to have a presence of mind at every time, because you are carrying such expensive equipment with you in your apron pockets, or in you've kept them in your ward, you've kept them in your OPD. So you carry the presence of mind in your toolkit as well. Thank you, Dr. Saranya, and let us. Do you have something to add, sir? Please.
As far as book is concerned, there are a few books that I would like to recommend. The books written by Dr. Namrata Sharma, Long Cases book, that you should always have with you. If you have any issue, you just go and refer to that. That will help you a lot.
So next we will call upon Dr. Pratik Nishant, who will be telling us about online resources for acing residency.
Welcome, Dr. Abhishek. So, online resources for acing residency. I'm Dr. Pratik Nishant. Let us begin with this very important session, which is very relevant today. That is because the greatest researcher of India, one of the greatest researchers of India, Dr. Santosh Honavar, has clearly mentioned in one of the editorials of the Indian Journal of Ophthalmology, 2 very important sentences: with the availability of vast and well-curated online resources, there's no excuse not to self-learn and fill in for deficiencies in training. And this applies to everybody in the ophthalmic scenario today. The second important line is the current conditioned and hypertrophic cataract-centric focus of the young ophthalmologist should give way to open-minded intensive learning of comprehensive ophthalmology. Cherry picking of commercially viable skills should change to a more broad-based approach. And this can only happen if you gather information from around the world and have a global outlook with local relevance. Why online? There's a huge community of ophthalmologists online, and many of them are young ophthalmologists. You have scope for learning from stalwarts as well as peer-to-peer. You have scope of improving your understanding and your memory, and you have inspiration for your content that you can use for your presentations and your teaching. So coming on, videos, ebooks, articles, and discussions. All these are available online. So surgical learning resources, the most useful resource that you carry around in your phone is YouTube. These are the names of our professors, our prolific surgeons who upload their videos for free and provide detailed discussions on how well the surgery is being managed and what your thinking should be. These are my recommendations. You can add your own in your in your Outlook. And one of them is Dr. Nato Rosatelli, who has uploaded some videos in 3D VR. So that is part of the message I want to put across, that if you have a VR headset, you can view those surgeries in 3D as if you are looking into a microscope. Then, of course, you have cataractcoach.com, about 1,000 videos related to cataract and refractive surgery and some others, which is led by Dr. Uday Devgan, one of the most prolific teachers of the US. Adding to that, you have One Network, which the access to which is provided by All India Ophthalmological Society, and you have top One Network videos of every year of 2022 would probably come up in the next week, and you have access to all of these for free, courtesy of the All India Ophthalmological Society. You also have iTube, which is the YouTube of ophthalmology, which carries only surgical videos of ophthalmology and nothing else. For theory and clinical skills, again, I'd like to recommend some of these channels, which is Moran Core Eye Center from the University of Utah, the iFocus video series, the AIMS set or the RP Center AIMS Delhi or the RP Center PG teaching channels. These are very important channels which set the standards of postgraduate medical education in India. The best of LVPI grand rounds are LVPI digital education and Eklavya Shankar Netralaya. These are channels which allow you access to inside teaching of these elite institutions, even if you do not have the privilege to attend them live. There's one ophthalmologist known as Tim Root who teaches in a lighter note things that which are very complex to understand, and he makes them very simple. So this is one of my recommendations. iRounds.org, iGuru.org, and CyberSite. These are three more channels that I would recommend for theory and clinical skills. For webinars and discussions, one of the channels is YouTube, which is from YOSI. These are videos for and by young ophthalmologists of India. And this hopes to be the preferred resource for you to submit your videos and your resources. AIOS editor proceedings, AIOS scientific committee, ARC, AIOS, and Daily Ophthalmological Society. These are very, very extensive. So I recommend highlighting only those videos which carry the word PG teaching in them. You can attend these PG teaching sessions for free, which earlier probably it used to be a Herculean task to go to different cities and attend, but now it is all available online. For ebooks, there are Telegram channels for shared ophthalmology books. Piracy is illegal and not recommended. Let this disclaimer be made clear from my side. There's an expert consult website which gives you access to portions or whole of books online, which you can freely copy and save to your computer. iWiki from American Academy of Ophthalmology, atlasofophthalmology.com, gonioscopy.org. These are websites which you can access for the purpose of having ebooks online. There are some promotional offers for ebooks going on now and then from various publishers, and there are books bundled with conference registration fees that you can look out for, and you can bag a good ebook for a very nominal price. For hacks during residency, life hacks or otherwise, these are some channels like Ophthalmobites, Dr. Pranesh Balasubramaniam on YouTube, AAO Retinoscopy Simulator, AAO Surgical Simulators, Slides from YOSI on the official website or on Instagram, and various Instagram channels that give out ophthalmology cheat sheets, important clinical images, and various kinds of stuff for free. So you can follow those channels and enjoy these hacks. May I acknowledge our teacher, Dr. Santosh Honavar, who has previously presented this topic on various forums. These are two YouTube videos, links to two YouTube videos which you can access if you want to hear it from him in more detail. Thank you.
Abhishek sir, you are a big propagator of self-learning, so
So I also learned my own channel. That is, I mean, that is. But then I just want to add, I have a lot of residents under me, and somehow I feel that my residents, I don't know whether the difference of my, when I was doing residency, it was in 2008-11, and now I feel that they are more focused to the online, But I just want to just give a simple message that take all and imbibe everything from the online, but don't miss this live, your surgical. When you go to your be inquisitive. Ask your mentors what is going on. Peep into the microscope. If you don't have access to the side scope, then look at it and keep asking and learn from that, because that is the best learning. There are a lot of inputs, but they can't replace your mentors or who are teaching you. So don't, these are add-ons. Use it, imbibe it, and then also translate it in your practice.
Yes, sir, has made a very important point. This 3 or the 6 years of residency that you have, that is a very, very precious time. So utilize that in the clinics more than these online resources. These online resources are there to stay, and these resources will be available to you even after you complete your residency or your fellowship training.
Just to add that, if you're going, like if you have an OT posted tomorrow, if you have an OT tomorrow, and you are a resident, you are going to the OT, know your cases, know what is being posted, what is being done tomorrow, and then
cases doesn't mean only cataract. It should be
it's
all the cases.
everything. Know it, see it on YouTube, see it on various online resources, imbibe the knowledge, and then ask your mentor, why are you doing this? Why this step has changed? Why are you not doing like this? So be inquisitive.
That has to go in parallel, and maybe that is more important than these online resources.
Yeah.
One thing
And
I would
always
like,
correlating with the clinical findings, like whatever clinical finding you see, and when you read up on the same day, then only you are able to imbibe it. Because just reading the theory doesn't make any sense at all. Like if you have seen the case, you will remember it for lifetime. That's what I think.
one thing I would like to tell that in today's era, Twitter has become very important, and lots of ophthalmologists are there on the Twitter, and AO and Retina today, they all post their links for the recent papers. You can download from there. It is very helpful. You just have Twitter and follow at least 10 to 15. There are links which you must follow. They are very useful.
At any point, if any audience member can want to ask question, please feel free to do so.
About those journal websites, I'm quite I'm quite open to discussion, because there is a lot of information coming through in these journals. What is actually relevant for residency or not relevant is quite, there's a thin line, and that line is quite blurred at places.
Can I add one more point?
Yes, sir.
See,
Please.
in the end, you have to learn, these are all edited. Very few are live videos or unedited videos. In edited, everything looks beautiful.
And out of 100 surgeries they perform, they upload one video. So the rest 99 have something that's why they are not getting uploaded.
Very important point. Yes, sir. Okay. So may I now call upon the next speaker, Nilesh?
Dr. Ankit Agrawal is caught up in FIFA, so he will be joining us a little late. So I am inviting my MBBS junior and a very good VR surgeon. She is Dr. Sabiksha Agrawal. She is heading her own VR practice in Allahabad and doing marvelously. She is going to talk about post-fellowship in Tier 2, 3 cities, the class act for the masses.
So yeah, I practice in Allahabad, which is kind of a tier 2 city. So I have done my fellowship from Narayan Nethralaya in Bangalore, and which is one of the premier institutes. And once I went back to my private practice in Allahabad, so there was a big culture shock. Once you study in the south and once you come to the north, and again, once you study in an institution in a bigger city and you come back and practice in a comparatively smaller city, then obviously there is a culture shock. You are lost, confused, unsure, little disoriented all those other things are also there in terms of patient communication. So once you practice in a smaller city, the paying capacity is obviously less. Since I practice retina, we all know that the amount of investment we do in retina is a lot more than what they are able to pay us. And again, they tend for the similar kind of thing, like if they have to do any premium surgeries or any retina surgery for that matter. So the amount of investment is a lot more, and patients tend to pay lesser in smaller city for the same thing. If they'll go to Delhi, Bangalore, for that say Chennai, Hyderabad, they'll pay in lakhs, and if they come to us, they'll tend to pay lesser. Then they have this mall versus general store. They have this mentality of mall versus general store. Like once you go to a general store, you know, bargain, and if you go to a mall, you never bargain, and you just take it for the MRP, and you don't even ask for it. So that kind of mentality is there in smaller cities. Again, a lot of quack practice in smaller cities. The patients are less educated. There is less awareness among the patients, and they tend to present very late in their condition. So again, in terms of practice, if you see, there is difficulty in getting good paramedical staff, you know. A good optometrist is very difficult to get. Immediate availability of good medicines, all those, like, even if you have to order an important intravitreal injection for that, say you have to order from Lucknow or Delhi. And again, if there is instrument breakdown, then repair of the instrument is difficult in a smaller city. Again, emergency facilities and all the higher investigations. For example, PCR was so commonly done there, and you don't get to do it here, biopsies and all those things. So patient tends to think that bigger city has better treatment, although if you have done it from a good institute, premier institute, still patients think that if they go to, you know, Chennai, Shankar Netralaya, LV Prasad, they'll get better treatment. So again, in terms of academics, if you see regular CMEs in bigger cities, like in Bangalore, we used to have conferences, CMEs every month. In Allahabad, for that say, they don't even happen for 6 months for that say. Again, newer technologies, newer like OCT angiography, ICG angiography is not available in the city at all. Then bigger machines and electrophysiology, genetic testings and all those things are not available in smaller cities. Again, the city life is not there. So poor patients, again, they tend to go to charitable setup, camps and government setup, and higher paying patients, they tend to go to the higher city. So again, when there are cons, there are pros also. Like if you see doctor to patient ratio, for example, if you see Mumbai and in Bangalore, a lot of, you know, there are 50 to 60 to hundreds of VR surgeons practicing there. Although in smaller cities, you just have 4 to 5 super specialists. So the doctor to patient ratio is good. Again, there is lesser competition, there is lower cost of living. You don't need cutting edge technologies to start a practice. You don't need a bigger building, a good looking building to start that practice. Again, you can start in a smaller setup. You get the staffs at cheaper rate, and it is, comparatively, it is not as saturated as a bigger city. So those were my takes in practicing in a smaller city when I came back from an institute.
Thank you, Dr. Samiksha. So I think you have just started. I also just started in a tier 3 city, that is Ara. Sir also is practicing in tier 2 city only in Patna, but at least he is in RIO, so he must be facing not facing the financial difficulty because it is a government funded institute, but still the acceptance part is very difficult.
I think, see, in Samiksha's slide, there were a lot of cons, and there was one slide on pros. so,
So we should focus more on pros.
I think you have to take a call. I mean, when you start, you have to take a call. No, the grass is always greener on the other side, right? In Bombay, if you ask somebody, and I'm a retina surgeon, I talk to my fellow retina colleagues, and most of my colleagues are attached to 4 or 5 centers. That is what I know. They don't have a single center. So in the amount of time that you take to grow big, where you have your own setup, where you can influence, where you can have an impact on the society, is the time, you know, there is always a denominator called time. And that time denominator is very important, that how much time it will require. So that is the process of having in a tier 2 or tier 3 city, where you can grow a big, and then as a independent, I am talking about right now about solo practice, when I am speaking my thought process. And then when you can impact the society, at every point of life now, you always question yourself that how my things can impact the society. So the point to attain that, the time factor is very less when you go in a tier 2 or tier 3 city. But if you start in your tier 1 city, even in an organization like LV Prasad or Sankar Netralaya, you might take 20 years. I have my coaches who are not satisfied even in Sankar Netralaya at 25 years of practice, because they are not able to impact the way they think, right? So, but then, as you have said, there are a lot of things which you get access to being in a tier 1 or tier 2 city.
Dr. Abhishek has rightly quoted that if you are working in a tier 1 city, that you have got lots of competition, lots of eye surgeons are there who will pose competition to you. But if you are working at a small place, you have open field is there. Though the patient think that for costlier surgery we have to choose higher centers, but you have to select your group audience, whom you have to focus there. Then you cannot immediately.
With current, I think the pace of life has changed a lot in the last 10 years. And in the current pace of life, if you are giving a good service at whatever place, the person who is taking that service, I mean the patient party, they are not ready to sacrifice time if they are getting a good service at that place. Right now, Nilesh has invested a big machine at his own setup. So he must have an audience for that, who are ready to buy that service and pay for that service. So I think that thing has changed a lot in last 10 years. Nobody wants to waste time. Everybody has time is, even for a farmer, the time is very precious these days.
So for me, when I shifted, it is a tier 3 city. My father has his own practice, so everybody thought that it is because he is having a practice, so I just want to join that. But I hate traveling. I don't want to waste my time in car. So in Delhi, if you are traveling from point A to point B, at least 3 hours a day you are just wasting. Every day of your life, 3 hours you are wasting. That should not happen. In this, I just come down from my home to my clinic. It takes 2 minutes. So I am available 24/7 for my patients if there is any emergency. I have fixed hours, but still for emergency, I am always available. It is very easy for me to do. And then out of my practice, I am taking out 1 lakh rupees and per month as a salary, and I don't know what to do with it. In a metro, if you are earning 3 lakhs and you don't know, it is not even sufficient to meet ends with 3 lakh of salary.
Yeah, but then it's just
just for economics,
I mean,
because everybody.
Apart from the economics, like if you are in a big city, there are things that your old generation has already built on. See, we as a researcher are just putting one more step to the numerous steps that have already created by our own older generation. So in a tier 2 or 3 city, you might be the person who is creating the first step. You know, you create an institution, but if you are in a tier 1 or tier 2 city, there might be already a lot of steps already created, and you have to just bring one more step to that. So in the whole perspective, you will be able to achieve something bigger in a tier 1 or tier 2 city. But in a tier 2 or tier 3 city, you might be the first person who will be creating an avenue for where your next generation can come and they can do something big which can impact on a research or an academic purpose. So that is a balance you have to find in your mind, your place where you want to.
Yeah, and in tier 2, 3 cities, you can go beyond yourself and create impact. That is a very good point.
That social impact factor is.
Yeah, is much more than a single person.
The problems are there, 3 problems are there. Keeping yourself busy in the practice, having good quality cases, and the economics. These are the 3 issues. So you have to organize yourself, you have to select the, means you have to make your community with other private practitioners, and database of your patients in timely messages, WhatsApp messages about your setup and other things, and getting themselves screened in time. So this will improve your economy. and will give you quality cases also. And with time, with 2 to 3 to 5 years of practice, you will become so much busy that all these things will not affect you.
And can
That,
I add one more point? I mean, even if you are practicing in future in a tier 2 or tier 3 city, never underestimate the power of social media. Show your skills on your social media, because everybody, even the farmer who is sitting and doing the crops, he is also watching the media. And if they see that the same skill is being provided by you in their own language, you have to communicate in their own language. You can't be very technical while you are communicating, right? You have to communicate that this technology, this asset is available in your area. So you have to be ready to show your skills in the social media also.
That's what I shared because we launched our website. It was unheard of to book an appointment through online, through a website in our city. I launched it just because patients were traveling a long distance, and we have a concept where we see a fixed number of patients, just like this. You have to take prior appointment to visit us. So patient had to travel from village to our center and then come back another day. So we started, and to our surprise, we have around 125 bookings in last 4 months. That from starting from zero, it is very good, and all of them are from villages. They are from villages. Normal illiterate person getting somebody to book their appointment, and they are repeat customers that they are coming. So we don't know what will click, and the dynamics are changing. So the tier 2 and tier 3 city is more tech savvy right now, because they are on phone, because they have a lot of time, so they are on phone more.
And one more thing, that if you are confused in your career that, I want to settle, I don't want to settle, give it a try.
Yeah.
Give it a try. Go stay there for 6 months. If you don't like, come back.
Yeah.
But give it a try, don't commit economically too much, that I'm investing that much. That is the catch. The catch is that you invest too much and then you get caught. Give it a try. If you don't like it, come back.
Thank you, Samiksha. I hope you will find more pros again in coming years. So when I started my PG in my senior batch, there were like 10 boys and 5 girls. And then in my batch, there were out of 15. In my batch, there were 7 boys and 8 girls. And then my junior batch, there was reverse, 10 girls and 5 boys. And just when I was passing out, the last junior that I saw, there were 14 girls and 1 boy.
Yeah.
And that's what our next topic is for the women ophthalmologist, how to break the shell and getting back into the practice and women ophthalmologist perspective, a very important topic. I welcome Dr. Shilpi Narnave.
अब ये उल्टा
She
होने
is
वाला है. अब हम लोग को ब्रेक करना है सर.
she is
Sir, as
practicing.
rightly said, even if you can see here, the ratio of males to females attending this session is totally reversed. So, good morning everyone. Thank you, YOSI, for this opportunity. So, we have already seen how to set up our practice or how to exceed while doing your post-graduation. So, it's time, especially for the women's ophthalmologists, how to break the shell and get back into the practice. So in India, yes, the medical profession for females, it has come a long way. But as we all know, even the first lady from the India, she was not able to practice after she qualified her medicine and in this thing. The male to female ratio in India is 64:36. But as to our surprise, the entry into the residency program is totally reverse. This is not the story of my life only. It is the story of 75% of young ophthalmologists who have 2 X chromosomes. So after getting the degree, we all are cloud 9, but while getting the degree, the age of ours is approximately around 26 to 28. So, and we also know that the residency in India is not sufficient that we can start our practice just after doing our post-graduation. So we are half-baked buns who are munched for the fun. So, but with this, we have the another responsibility, like we're getting married, and with that, there is baggage of responsibilities of in-laws, husbands, and pregnancies. So I became a super mom, a super wife, but at the end of the day, I was not happy because what I wanted, what I was missing was my career and my profession. So it was the professional growth and the career which was just letting down. If I see my male peers, they were growing in their profession because they were not having any baggage, and I need to struggle with my baggage to cope up with them. Above that, there was a guilt, family guilt, how to balance the profession and the personal life, and always the thought crept in, why should boys have all the fun and have the right to chase their profession? It was not only the financial dependence which was not boosting up the morale and the confidence, and also I always used to think why I burned the midnight lamp for the 10 to 15 years to get the degree, just to become a housewife. Do I not deserve? I always fight for the higher education because I belong to a society where the females are not allowed the higher education, and then I fight with my family for intercaste marriage and then risk my life for 2 pregnancies. I have been fighting since childhood. I am more than a fighter and not just a pretty face. So I decided to fight one more battle, and it was no one by else, it was only me who could fight for myself. So now what? I didn't have any golden spoon or a magic wand, and no other opportunity was knocking out the door, so I decided to cut few strings to become a super doctor. So I decided to do a fellowship in ophthalmology, but it came with the mentor expectations of 24/7 work, no free lunches, no more holidays and everything. But I found, and my favorite mentor unleashed my passions, channeled my energy, guided my growth, and encouraged my success. But then crept in the mom guilt. So it was like that I realized later that it is not the quantity time, but the quality time to the kids which matter. And these studies also boost up my morale and confidence that I'm not doing anything wrong with the family or the kids. I have 2 daughters, and I never wanted them to have a feeling that even if you have a successful academic career, ultimately you have to do just the household work, and I wanted to be a role model for them. But the another stone was the patriarchal system. Though I married my lover, but ultimately after marriage, even the lover is your husband only. So you need to share your dreams, your guilt with him. Be clear, don't try to convince. Just tell them that the joint goals is better for the both happiness. And remember, always a contented and pacified husband, he hear a lot more when he is very satisfied. And then he started sharing my profession, work, my household work, and the responsibilities. So don't be a woman that needs a man. Always try to be a woman a man needs. Always keep your in-laws in the loop and share your dreams with them also. But remember, you only have 86400 seconds in a day. So you need to strategize how to balance your life, work, and the career. So make your mornings less stressful, work after your family time, study after your family time. Create a support system around you for the household work. Avoid from the social media during your learning time. Yes, many a times the thought crops in ki whether I will be able to do or can continue, or I will succeed or not, or I'll have to take back a step. But remember, don't try to be perfect in everything. So by all this, this is where I am standing now. I am a vitreoretinal surgeon and an ROP specialist with more than 35 publications, multiple awards with the degree of ICU and in FICO, multiple awards and 5 cover pages in the international journals. And beyond that, I'm a principal investigator, a quizzer. I'm financially independent. I own a house and a car and a joint organizing secretary of the VRSI. So friends, it's a time to break out of your shell and show the world who you really are and what you are really made of. So get up and live up to your dreams. Thank you.
Viksha, you should lead the round.
Really motivating talk, Dr. Shilpi. And yes, this is true. Like even I got married during my residency. I was in second year then, and a lot of my in-laws and other people, they demotivated me for to go for a fellowship, because I had to stay away from my husband for 3 years after my marriage. So yeah, again, and they were like, you are a female, you can't do a retina surgery, it goes on for 3 to 4 hours. So all those things are true actually. They tell you as a female ophthalmologist, they say that this specialty is not good for you, but I think you should take your passion and you should do what is best for you, and you only do that.
So, as male ophthalmologist, I think we should have to learn to share the burden. That's the message I have got. Yeah.
What I want to share is something on a very philosophical basis, you know. So this is my experience with my family. So I was in Bombay in 2008, around 2008, and my brother and my sister-in-law had just moved to Bombay. And Bombay, as you know, is a very stressful place. It's a very stressful place when you work. There's a lot of issues started with traveling, and then in India, the work time is not defined. That is the problem India has. Like in foreign, you have a defined work time. That 9 to 5 is 9 to 5. But in India, the 5 is not defined. It can be 7, it can be 8. That definition is not there, and that doesn't translate into your increased pay or something like that. So my sister-in-law was also working, and they both were traveling, going from their place and coming back. What I found strange was that my sister-in-law took that onus that she has to do all the household chores. That the onus was on her, like it was carrying on her that I have to do and take care of the whole family. So in Samiksha's I think in your one slide you said that no, you should be sharing work and this. This is a balance that you have to find with your husband or your family if you do have a family. That this should be translated, and you should not carry on yourself, no, that I am a woman and I think. What I want to communicate is that as a woman you carry on yourself. I mean, obviously you never want to, but then I find many women in India, working women, that is a guilt that you want to carry, that I also want to do this, I also want to do this, I'm not able to do this. This should not be there, you know. It should be, he is also working, I am also working, and we both have to be balanced. I mean, I'm working totally.
Yeah, a few things I would like to add to Silpi Nirvan is, she has rightly commented that it is the quality of time that is spent with the children is important, not the quantity of time. And the few things that we can just at this level, means being an eye surgeon, there should not be difference between male and female, though there are hurdles. For a female ophthalmologist, but there should not be differences, because to coming to this level, means passing MBBS and doing MS, these things, if someone has come to this level, then society and the family should not put hurdles. And few things that can help. Two things that are causing problem, one is pregnancy and second is the child care. So you must have.
मैं इसको एक में समराइज कर दूं. मेरी वाइफ मेरे को छोड़ सकती है, मेरी मेड को नहीं छोड़ेगी, अपनी मेड को नहीं. सिंपल चीज है, अपना एनवायरनमेंट क्रिएट कीजिए जो आपको हेल्प करे, और उसको
Good support system
क्रिएट करना जरूरी है.
made just to have a few persons from low socioeconomic group. You have good contact with them, not just 1, 2 to 3, so that they can help you at your house, abroad also. They can accompany you. You just pay them good, they will help you. And focus on the quality time with the children.
And regarding the patient who want to choose male ophthalmologist over female ophthalmologist, in coming 4-5 years, they won't have any option. So वो झक मार के आएंगे. So don't be.
That issue is more with tier 3 cities now. I think tier 2 and tier 1. I mean, still there is some place,
but
yeah.
still they won't have any option.
Yeah.
When there are so many female ophthalmologists,
Yeah.
they won't have any option.
Yeah.
So, moving on to the last talk of the day, it is from Dr. Prasanna Venkatesh Ramesh. It is as vibrant as he is a CrossFit, so that you are not a misfit.
Thank you, Team YOSI and Nilesh, for this opportunity. To be part of such a honest and wonderful discussion among all yos, I think we are all learning from each other regarding work-life balance, management of stress, which cities we are coming from. I would just like to share some bit of my own personal take on fitness. I always feel that, personally speaking, from my part too, I was, to start off from my postgraduate or even my undergraduate days, used to have a very bad eating lifestyle, a lot of eating food outside. We always take the health for granted, but as doctors are always poor patients, is what even our colleagues will used to tell us. So my real awakening came in 2016 when I started to focus on my health, because when we set health as the priority, I think everything will fall into place. So how did I go about my health is just one particular method. It doesn't need to be the same way, but I just thought I'll just share my experience because that paved the way for my innovations or my glaucoma academics or my surgery. So I started doing CrossFit. For me, when I go into a gym, for me to break the routine, the trainer used to make me walk for 15 minutes in a treadmill, 15 minutes in a cycling. I felt when I wake up the next day morning, 1 week, I joined January, then I stop going within a week. That was happening till 2016. But CrossFit, what it gave me was every day the trainer or the particular gym, they focus on different modalities. So today if you are having a skill-based learning, tomorrow you will be having an endurance-based learning. You never know what you are going to do until you go to the gym, because that's the part of that particular training called the CrossFit. Some days you will have an animal day, some days you will have a leg day, some days you will have a hand, or some days you'll have a core, or some days you'll just have like a therapy session, group therapy. You'll be having a therapy where all 10 people will be doing an exercise. There will be always 5 people will be above you, 5 people will be below you. So you'll always have that urge to actually make the match of that one particular person who's actually doing the greatest one. So this, my dear friends, I felt really helped myself. So after this moment, I took my day as only 23 hours a day. 1 hour a day, whatever happens, if we don't invest in our health. So we are talking about financial investment, we are talking about emotional investment regarding the family practice. One of the speakers before me talked about the emotional investment, being a mom or being a father. I really feel investing in our health is very important, because the people that I'm seeing here who are on the dais or the audiences here, we all have high aspirations, high ambitions. For that we just need to be there. Not only being there, being alive I mean, but we also need to be healthy. So what really matters to you? Do you feel if you are a gym person, really go to the gym? If you want to do different exercises a day, this is my mentor. The previous speaker also pointed out regarding my mentor. It is my mentor, Dr. Satyan Parthasarathy. At the age of 55, you can see my mentor. He's giving tough competition for me in the upside down there. So many of you will be knowing Dr. Satyan Parthasarathy. He's a doyens in glaucoma. So he used to take him with me in the morning, and we used to do all kind of crazy workouts. But this, my dear friends, it's not routine. And even I do have my spirituality too. You can always have your own core, being a spiritual one, or even if you are an atheist, make sure you have some fundamental grassroots core where you are actually rooted, so that every day when you wake up, you always have something to keep going, because we always need that particular adrenaline, or I always feel get the adrenaline out of your body, so that when you go into your OR, your body just feels perfectly fine. If there is a complication before this, I always have a kind of anxiety spell or a tachycardic, but after this CrossFit thing, even when there is a complication or anything, since your adrenaline is already out of your body has a tremendous amount of, it has its own way of having its own cool and composure. I feel always a sport person now, they are all focusing on yo-yo test and other things. We as doctors, I feel it's time for us to move towards all these things. See, this has really helped the last 2 years in my academics as well. You can see that there was more rejections when I started, but now this is my IGO portal, close to 50 publications now in Indian Journal of Ophthalmology. My academic growth has come up very well. I have an image published in American Academy of Ophthalmology. I have done 27 in the regional journal as well, and 51 in IJO. And currently, after my fitness levels, my physical fitness has added to my mental fitness, and I'm currently 109 publications old. All of them are in good PubMed index journals, and 145 peer reviews have been done. And this is my citation of 149, and you can see I really had a peak of 2022. So all the investment that we did on physical health, it'll always have a good stamina on your mental stamina too. you'll have a good mental stamina, your mind will be brisk. I was a non-vegetarian, I converted into an vegetarian. It's all personal. Whichever works well for you, I think you can easily follow it. I'm just sharing one particular advice of mine, and it has really helped my academic growth, be it the awards that I have won in the last 2 years, or be it the ideas that we really get in the academic forum. Many ideas I do get it in my gym as well. Even suture training, when I was doing a reverse rope climbing, I was thinking, okay, this is how we can do a suture training, because the day starts well. I try to avoid starting the day on an anxiety or on a stress level. Even if it is very anxious or feeling very low or depressed, I try to go into the gym. I just try not to avoid it. I at least try to have 5 to 7 days in a gym, and I think that's really showing off in my academic growth. And I also had the birth of my second daughter. All this changes you as a person. I do have 2 daughters, but my second daughter is always special. That really toned me even much better. Fitness, spirituality, this is my first daughter. I think it's all a balance of everything is what I really feel. I am just 63 kilos. I drive a bike which is 306 kilos. Can you just imagine? Because it's all possible with fitness. So this is my bike of 306 kilos. Every weekend I drive with my daughter. Second daughter is just a year old, so it's not possible. But with my first daughter, I do go out with rides, and these are my cover images, chapters. And this is one patent recently. I got inspiration from my colleagues like Nilesh, who had their own patent in digs, and this is my innovations, which I have my own patent. And I'm also an YO, but 2022 fitness paved the way for a lot of academic orations, the YOSI Governing Council, the 7 ACRS awards they recently won, and the DreamCon cover picture image was one of the images that we have done from our team. And I think, my dear friends, to add on, we can keep going with a lot of accolades and awards, but I feel personally fitness starts from the mind, body and social. Because, and this is my TNOA, I'm also an executive member in TNOA, my regional parent body, and I always feel fitness starts from the physique, mind and social. And currently I'm the associate editor in the TNOA journal as well, and I take inspiration from people as well, meeting positive people, taking inspiration, and that's it. Can I have the slide? Yeah. So to summarize, now currently going into MIGS as well. So I always feel focus on your fitness, fitness, fitness. Health is defined as physical, mental and social well-being. Make sure we draw a line between what is the physical health, are we physically healthy, are we mentally healthy, and are we socially healthy. So with that message, I would like to thank the YOSI once again for giving me this opportunity to share the last 5 years of my life or so, how fitness really changed the way of my physical way of handling, mental way and the social way. Thank you, Team YOSI, once again.
Yes.
So that is really inspiring. The physical fitness do take, like it allows you to do so much. I know him personally, and still in our YOSI discussion, I wonder how he is everywhere. Because you will see him in all the conferences bumbling up, and then he has time for innovation, he has time for academics, he has time for his family, and to do the executive work also. So that kind of fitness level you get, that kind of energy level you get when you work on your fitness. For my personal experience, I might not look like that, but I was 105 kgs when I was doing my internship. I was like 1.5 times of this, because the last 10 kgs really bloat you up. And then I took 1 year off. After my MBBS, I was supposedly preparing for my PG entrance, but I took 1 year off, worked on myself, got back to 80 kgs. Now I have again bloated up to 95, 96 right now. But that helped me to crack the exam, because I was so lethargic, I was not able to focus more than half an hour. So I was like, if I need my life to be sorted, I have to take a break. 1 year is nothing. So I took a break. So sometimes if you think that your energy level is going down, your life is going nowhere, just take a break of 3-4 months, work on yourself, and then get back into the groove.
I think that's a very important point. Even today, the breaks are very important. Sometimes we need to slow down when our body demands or our mind demands, and we need to know when we need to take a break. Even as Nilesh was telling, 2 months, 3 months, or even once in a year, even 2 weeks, 3 weeks. I even do that even today. Even last year, it was, I felt slightly, fatigability was slightly reaching, and the last week of December, I just took a break. taking breaks at the right time mentally, physically rejuvenates us, and I think it sorts many of the family bonding and other things, especially when we have kids and other things. We'll have to invest in family also. So just like
And from my personal experience, many people who think they have to take a break, they go on vacation, and then they have this big itinerary of the vacation. In morning 8 o'clock we have to visit this point, and then 8:30 we have to take breakfast at this point, and then again it is work. So if you are taking a break, go on a hill station, book a room, and be there. Just lie down in that room and spend your week over there. That is the break you need to take, not to take off the tourist destination.
correct, correct.
I think the next session is there.
Sir?
We are,
Yeah.
we are running.
Yeah, sorry. We will wind up. Sir, any last comments?
Yeah, detoxification is necessary. What Prasanna is telling that just you should have to be fit to make yourself fit for the practice and other things. And Prasanna is doing good, and what he has depicting here through the example that how he is doing all these things so well. As rightly has been quoted lots of time that healthy mind resides in the healthy body. So therefore we must keep ourselves healthy. There are few tips through which we can keep ourselves healthy. Dancing, yoga, aerobics, all other things are there which can keep you healthy. Okay.
Thank you so much. We will end the session. I'll request all the panelists, chairperson, and the speakers to be come for a group photograph, and we'll conclude. I would request all the audience member also if they can join us so we can have a memorable photograph. Thank you.